Namaskar, myself Dr. Tushar Godbole. I am a pediatric endocrinologist and I welcome all of you to our YouTube channel Harmony in Health. Today we are going to discuss one important topic, and that is the types of diabetes. But before we do that, let me take a quick recap of what we discussed in the previous episodes. What is diabetes? So diabetes is a health condition. It's a metabolic disorder where you get elevated or high blood sugars. But it is not just the elevated blood sugar that causes the problems. It is the chronic or long-term elevated blood sugar levels that affect the heart, the nerves, the retina or the part of your eye where the light rays are falling, and also your kidneys. So the metabolic effects of the elevated blood sugars is what causes the diabetes related complications. How do we define diabetes? So diabetes is defined on certain numbers. When we check the blood glucose in a fasting state, in a normal individual, the fasting blood sugar is always below 100, whereas in a person who has pre-diabetes, which is also referred to as impaired fasting glucose, the fasting sugar often tends to go beyond 100 but not crossing 126. In a person with diabetes, it is often observed that the fasting blood sugar is often crossing 126 mg per deciliter. Talking about the post-glucose sugar, in a normal individual, the post-glucose blood sugar that is measured after 2 hours of consuming 75 grams of glucose, the 2 hours post-glucose sugar is generally below 140 in a normal individual, between 140 and 200 in a person who has pre-diabetes or also referred to as impaired glucose tolerance, and in an individual with diabetes, the post-glucose sugar is generally crossing 200. In a person with symptoms of high blood sugar such as excessive thirst, excessive urination, recurrent infections, any random blood sugar that reaches 200 or above is taken as the diagnostic cutoff for diabetes. And if you are resorting to a blood test called as HbA1c, the HbA1c value of 5.7 or less is considered as normal. Any value between 5.7 and 6.5 is considered as pre-diabetes, and the values above 6.5 are considered as diabetes. This definition of diabetes remains same for all age groups, be it a child or an adult, and it remains same for the kind of diabetes, be it type 1 diabetes or type 2 diabetes. Now, how do these numbers arrive and what are the basis for these numbers? We have seen in the previous episodes that these are the numbers that correlate with the long-term complications such as microalbuminuria, that is the leakage of protein through your kidneys, or the retinal damage that happens due to the high sugar. So these numbers are derived via large amounts of data that has been gathered over years, and we know that there is a scientific rationale behind these numbers. It is often argued by many patients that why should I bother about these numbers because I don't have any symptoms of diabetes. So it is often said that diabetes is a silent killer, and that's the reason you should take action before the symptoms happen. Now, before going to the types of diabetes, let us see how the blood sugar is controlled in a normal individual. So the blood sugar gets absorbed from the digested food, from the intestine. It enters the blood circulation after the churning process that happens in the intestine, and various intestinal juices and the pancreatic juices act on the food, helps it get digested, and the glucose is released from the food, gets entered in the bloodstream. Once the glucose is available in the bloodstream, there are sensors in the beta cells of pancreas. The small amount of cells, the 5 to 10% cells of the pancreas that are called as beta cells, they have a sensor that can detect the fluctuation in the blood sugar. It knows that the individual has had his lunch or dinner, and they start acting, and proportionate to the rise in the blood sugar, the insulin making beta cells will start working and they will pour out insulin in the circulation. Now, once the insulin is available in the blood circulation, it will grab hold of the sugar, it will carry the sugar along with it throughout the bloodstream, and it will go to various organ systems. It will kind of knock the door of the cells. There are receptors of insulin on various tissues, various cells, including your muscles, your fat cells, your brain cells, your heart cells, and practically every possible organ has got insulin receptor. So this receptor is the door where the insulin is going to make a knock. After the insulin knocks on the door gets opened and the glucose enters the cell where it is utilized as a source of fuel. So glucose is the main source of fuel which is available from your digested food. Insulin helps in assimilating the glucose or distributing the glucose throughout the tissues, and the cells can utilize the glucose only if the insulin is available and it is acting correctly on its receptor. So based on these background information, we are going to divide the diabetes into various types. Types of diabetes can be divided by and large into 4 or 5 categories. Talking about the types of diabetes, type 2 diabetes is the most common sort of diabetes, which is caused by an entity called as insulin resistance. We have seen that the insulin will act on the insulin receptor and open the doors for the glucose to go inside the cell where it is used as a fuel. Imagine the insulin being the key and the insulin receptor as a lock. Imagine the lock is rusty and it is very hard to open, so you need to put more force on the key in order to open the lock. Similarly, insulin resistance is a condition where the insulin receptor is not acting optimally and the doors are not opening well. So as a result, to overcome this insulin resistance, body has to produce more and more insulin. So it all begins with insulin resistance followed by pre-diabetes, where the body is trying to take care of the sugars by making more insulin, but eventually the beta cells will get tired of this overwork or the extra burden, and eventually the cells would reduce their functionality and the beta cell mass will get depleted over a period of time, and that is when the insulin production also gets hampered. So this is type 2 diabetes, which is the most common part of diabetes. It is caused mainly due to obesity, also due to bad lifestyle. There are genes that are responsible for type 2 diabetes, but those genes will get manifested when they have a proper environment such as bad lifestyle, lack of sleep, lack of exercise and bad eating habits. Type 2 diabetes being the most common type of diabetes, it is seen in almost 8 to 10% of the Indian adult population, and India being the diabetes capital of the world. The second type of diabetes is called as type 1 diabetes. We are going to have a dedicated episode on type 1 diabetes. But what is type 1 diabetes? It's a rare kind of diabetes, happens in 1 lakh population, typically happens in children or individuals below 18 years of age, and where you generally do not have any genetic background in the parents. Now type 1 diabetes is a condition where the insulin production is getting hampered. So the beta cells are not able to produce insulin because they are damaged as a result of something called as an autoimmunity. Auto means self and immunity is the body's defense mechanism which helps you fight against various bacteria, various viruses. This immunity by mistake targets your own cells and destroys the beta cells over a period of few weeks to months, and as a result the beta cell mass gets depleted, the insulin production gets hampered, and as a result the individual is no longer making enough insulin, and this is what gives rise to insulin deficiency, giving rise to type 1 diabetes. Type 1 diabetes happens in a population of 1 in 1 lakh. Coming to the third type of diabetes, which is also called as type 3C diabetes, which is called as the post pancreatitis diabetes. pancreas is a big organ which makes insulin, but that is only the 5 to 10% of the cells. Rest 90% of the cells are making digestive juices, and together this pancreas not only helps in digestion of the food but also the utilization of the products including glucose. Now there is a condition called as pancreatitis, which could be genetic in origin, which could be an effect of drugs, or it could be a result of some infection. So this pancreatitis, when it is happening chronically or repeatedly, then it can give rise to a diabetes called as post pancreatitis diabetes, also called as type 3C. There are certain special situations of diabetes, special categories of diabetes. Some of them are purely genetic. Take an example of MODY. MODY, also called as maturity onset diabetes in young, is a 3-generation diabetes where you get the diabetes in 3 generations: the grandparents, the parents, and the child. These are the individuals who are generally not obese. They generally do not have insulin resistance, and it's a purely genetic form of diabetes transmitted from generation to generation. There is a rare condition, 1 in a million condition called as neonatal diabetes, where the diabetes begins right from the birth and the babies get diagnosed with diabetes before the 6th month of age. I'll repeat, 6th month of age or before. If the baby is getting symptoms of diabetes such as polyuria, polydipsia, weight loss, and the blood sugar is elevated, that is how you make the diagnosis of neonatal diabetes. Many of these neonatal diabetes are in fact transient. Some of them get better with age, some of them disappear with age, and some of them are amenable to treatment with oral hypoglycemic drugs. There is an entity called as gestational diabetes. Gestation means pregnancy. So a girl, a lady who is going to get pregnant is already having an overloaded system. The beta cells are barely coping up with the sugars, and on this overburdened system, when there is an extra burden of pregnancy, extra load, extra demand of pregnancy, that is the time the beta cells would start failing. They would not be able to produce enough of insulin, and this gives rise to elevated blood sugars only during pregnancy. After delivery, as the extra burden, extra demands are offloaded, the lady is again able to maintain the sugars, and as a result the diabetes goes away. So this is called as gestational diabetes, but please remember, gestational diabetes is often followed by the real type 2 diabetes in the years to come. So often it is said that gestational diabetes is just the trailer and the real movie or the real picture is going to get unveiled after a couple of years. So these are the types of diabetes. Why should we bother about the types of diabetes? Diabetes का प्रकार कौन सा है, इसके बारे में हम क्यों चर्चा करें? कल्पना कीजिए आपको मुंबई से नासिक जाना है, तो आप ट्रेन से जाएंगे. If you wish to go to Alibag from Mumbai, then you will have to take road. If you wish to travel from Mumbai to Lakshadweep, then you will take the cruise. आपको जहाज से सफ़र करना होगा. और आपको मुंबई से दुबई जाना है तो आपको हवाई जहाज़ यानी कि एरोप्लेन से ट्रैवल करना होगा. Similarly, the type of diabetes dictates the treatment modality. If you are suffering from type 1 diabetes, then your body is not making insulin, the beta cells are destroyed, so you must take insulin injections from outside in order to control your sugars. But if you are suffering from a condition called as type 2 diabetes, the oral hypoglycemic agents will help you in addition to a healthy lifestyle and weight loss if you are suffering with obesity. If you are suffering with gestational diabetes, then the dietary modifications are the first line of management. अगर खाने पीने का संतुलन से आपका शुगर कंट्रोल नहीं होता है तो जेस्टेशनल डायबिटीज़ में इंसुलिन या गोलियों का सहारा लिया जा सकता है. अगर आपको जेस्टेशनल डायबिटीज़ है तो डिलीवरी के बाद में डायबिटीज़ चला जाएगा, लेकिन 1 या 2 साल बाद आपको टाइप 2 डायबिटीज़ होने का खतरा है, जिसके लिए आपको पहले से सावधान रहना है. और अंत में अगर आपका डायबिटीज़ जेनेटिक प्रकार का है तो किस प्रकार का जेनेटिक डिफेक्ट है इस पे आपका गोलियों का चॉइस भी डिपेंड करेगा। और आपको अगर पैदाइशी यानी कि नियोनेटल डायबिटीज़ है तो आपको गोली का प्रयोग करने का सलाह शायद आपके डॉक्टर से मिल सकता है। So it's very important to know the type of diabetes. To conclude, please go and discuss the diabetes, your condition with your doctor, and please try and understand what type of diabetes you have so that you can take care of the diabetes very well. Respect your diabetes so that it will respect you, and surprisingly the corollary is also true. So take good care of your health. Please like, comment, subscribe and share to our YouTube channel Harmony in Health, and until then, goodbye.